every day is a good day to take care of your kidneys and talk about kidneys. So third talk is about kidney only, a unique case of nephrotic syndrome. The talk is going to be delivered by Dr. Vipul Parmar. It is his first CME as a delegate and a speaker. Welcome, doctor.
Thank you, APR, for giving me this opportunity. So we all have heard of Operation Sindoor, but have you heard of Operation Saundarya? We'll talk about this in last slide. So I'll start with the case. A 32-year-old female patient working in a mall as a store manager. No any previous comorbidities. Patient presented with bilateral pedal edema, facial puffiness followed by anasarca over the period of 15 to 20 days, gradually progressing. So patient has no any history of shortness of breath, chest pain, palpitation, no abdominal distension, hematemesis or melena, no fever, no allergy, no insect bite, no trauma, no any use of alternative medications, no hematuria, no cola-colored urine, no renal stone, no diabetes, tuberculosis history, no lower urinary tract symptoms, nocturia or weight loss, no chronic back pain or NSAIDs. So investigation suggestive of CBC was fine, creatinine was 0.44 normal, liver enzymes were within normal limits, HbA1c was fine, total protein was on the lower side 4.26 and albumin was low 2.2. AGA ratio was reverse, cholesterol was higher side, triglyceride was also on higher side, C3 was normal. Urine routine micro examination showed albumin 3 plus, RBC 4 to 6, fresh RBC, no cast, WBC 2 to 3. Urinary protein to creatinine ratio was done, which was on higher side, 14 gram per gram. Triple H was non-reactive, chest X-ray was normal. So what could be the differentials? This was a nephrotic syndrome, so possible diagnosis should be minimal chain disease, FSGS or membranous nephropathy. Second possibility is lupus podocytopathy. We did a NA by IF was negative, so lupus was ruled out. PNK was negative. Anti-plateau antibody usually when we suspect membranous nephropathy, we do usually it was negative. Renal biopsy was done, which was suggestive of membranous nephropathy, but the antigen which found positive was NEL1, that is neural epidermal growth factor like protein 1. So already my previous speaker has suggested the importance of past history. So retrograde history was taken. The patient had any history of or exposure to metals like gold or mercury. So patient had a recent use of whitening cream since last 6 months. So this was the cream that shown. This is widely available in Amazon and Flipkart. This was the medication. This is Gore Pharmaceutical. It is made in Pakistan, Lahore, and this was the medication she was using for more than 6 months. So her mercury level was done. It was 22. The normal range is between 0.2 to 1.3, but it was found on higher side. So usage of that fairness cream was stopped, and in view of nephrotic syndrome, it says patient was on reproductive age group, 32 year. So patient was given injection rituximab 1 gram 14 days apart, along with supportive care, angiotensin receptor blockers, diuretics, and follow-up after 60 days showed reduction in the proteinuria, and edema was subsided. So what is membranous nephropathy? It is characterized by massive proteinuria, more than 3.5 gram per day, and clinically presents as a peripheral edema through the urine and or manifestations of thromboembolic phenomenon. Laboratory finding shows hypoalbuminemia, dyslipidemia, and or AKI with elevated creatinine. The lack of active sediments with absence of hematuria or RBC cast in urine microscopy differentiates it from nephritic syndrome. So etiologies are maybe primary or secondary. Primary etiologies were responsible for 75 to 80% of the total membranous nephropathy patients. Most of the reason is idiopathic. But in recent scenario, in the biopsy patient, 70 to 80% patients are found antibody against the plateau receptor antigen. 15 to 20% in cases, antibodies are found against NEL1 antigen. 1 to 5% THSDA7A antigen, and others are non-specific, rarely found. Secondary cause responsible for 20 to 25% of the cases. Infections like HIV, hepatitis B, C, syphilis, malaria, HIV, schistosomias can cause. Neoplasms like adenocarcinoma, squamous cell carcinoma of the lungs, or GI tract, hematological malignancy can do. Drugs like NSAIDs, anti-tumor necrosis factor alpha inhibitors, penicillinamide, probenecid, heavy metal poisoning, gold, mercury, which was in our case, autoimmune diseases like SLE, Sjogren, rheumatoid arthritis, IgG-related nephropathy can cause miscellaneous hematopoietic stem cell transplant, graft-versus-host disease, and diabetes mellitus. So this chart we already discussed. So what is the basic pathology? This is the GBM and this is podocyte. There are food process of podocyte at which these red colored dots, which are antigen, and due to autoimmunology, these factors antibody occurs and that bind with this antigen that complex causes. This is the normal pathology of podocytes, but due to this actin and this nephrin slit diagram is deranged, so this shape becomes like this. So there is effacement and there is leakage of protein. That's why nephrotic syndrome occurs. So one research paper I found out that NEL1 associated membranous nephropathy linked to skin fairness cream use, and it was Indian case series used in this paper was published in South India, and they reported at 15 patients in the span of 2 years in which NEL1 membranous nephropathy was found. 13 of the patients were using unlicensed skin fairness creams. It is used. So they give the data in which we can see the 15 patients. Most of the age group is younger age. Most of the patients are female. Urine protein creatine ratio very higher, like in our case. Creatine was normal at that time. Deranged lipid profile. Albumin was low on the lower side. They were using the fairness cream from 2 months to 2 years, and some of using at the time of biopsy also. So mercury level was done, which was on the higher side, and urinary protein level, mercury urine level also done. It was also on the higher side. So after stoppage of the using, that time of remission was starting from 2 months to 17 months. So complete remission occurred in the most of the time. Some patients were on the follow-up at the time of study, and most of the patient immunosuppression was not used. And after follow-up, patients creatine remained the normal and urinary protein creatine ratio was on the normal side. So fairness cream analysis was done, and some familiar creams were having more mercury level. Lipoic acid, we have already used, or we have seen the prescription in which lipoic acid is commonly used. It is popular over-the-counter antioxidant and insulin mimetic supplement used in variety of conditions, including multiple sclerosis, diabetes, and schizophrenia. In Alzheimer's disease, this product is also used. So one research paper was done that lipoic acid supplementation was associated with NEL1 membranous nephropathy. So this article was published in Kidney International Journal, and the conclusion was that in 5 patients we are using the lipoic acid. Biopsy was done in all the patients, and after continuation of the lipoic acid and supportive care, all patients were in remission and no immunosuppression was required. NEL1 is also a target antigen in malignancy-associated nephropathy, and but the change of the treatment is then when membranous nephropathy associated with malignancy, we have to give immunosuppression along with the treatment of malignancy. Traditional indigenous medicines are etiologic consideration for NEL1 positive membranous nephropathy. So 3 Indian system of medicine, Ayurveda, Unani, and Siddha, have been receiving considerable encouragement by both central and state government. In Tamil Nadu, where the Siddha medicine was originated, there are over 100 Siddha hospitals, nearly 300 dispensaries, many of which are the wings of modern medical hospitals. They have 2 medical medicine college using Siddha medicine with 50 beds each. Swasakalpa is the most common Siddha medicine used, and it was analyzed for the mercury content by mass spectrometry, and it contained greater than 200-fold higher mercury than permissible exposure limit. Rasagandhi Mezugu is also the medicine which is widely used, but right now it is not that much used. So this is the filtration process. In Unani medicine, they are taught that the mercury has to undergo 14 type of filtration process, then after they can give to patient. But breach in any filtration process or adulteration or unlicensed use can cause mercury toxicity. So that was the paper again published again for that traditional indigenous medicine, and conclusion was that 35% of the patients with membranous nephropathy in India have the history of traditional medicine use, with the majority case of NEL1 positive. So mercury is ubiquitous heavy metal with potential toxic impacts on human and environmental health. There are three types: metallic, liquid, mercury, which we have seen in sphygmomanometers, barometers. Organic methyl mercury is found in sea. Adulterated fish or seafood poisoning can cause methyl mercury poisoning, and inorganic, that is methyl chloride, and that is used in fairness creams. The mercury compound in the cosmetics have directly inhibition of the melanin production. They whiten the skin and remove the facial plaques. That's why they are highly used. When absorbed through the respiratory tract and the digestive tract over the skin, they compound dissociated to yield mercury ions. They enter the blood and subsequently they damage the brain, kidney, and nervous system. They can cause also cardiovascular, musculoskeletal symptoms as well. So this we have discussed already: skin whitening creams, traditional medicine, and these fluorescent labels and thermometers. These are the potential risks for mercury poisoning. So these are the pictures of some widely available beauty products. They are used not in India but all over the world. These medicines have to be present in mercury high content. These are some famous names: Aroma Magic Fairness, Olay Natural, Pond's White Beauty. They actually in India it is unlawful to add mercury, but in this study or this mercury level is high found. Garnier Men, Vivel, Umami, Lakme, VLCC, Fair and Lovely. So membranous nephropathy, if patient is having low proteinuria, we can wait and watch. But after 6 months of approach, patient is not getting relieved, then we have to give immunosuppression. In our patient was having 14 gram of proteinuria and nephrotic syndrome, so that's why we have given rituximab in that patient. So Operation Saundarya we had already discussed. In South India, due to high use of fairness cream, there is more licensed cream used in Kerala. So government of Kerala had organized officially Operation Saundarya, and this 2 men back in February month, they have sold more than 8 factories producing this particular cream and sold 10 lakhs of worth of fairness creams.